Welcome back to the Muscle Whisperer, Thoughtful Tips for the Therapist video series. My name is Cassandra. I'm from the North London School of Sports Massage. I work in a private clinic as well as working and spending my time in professional sport. In this episode, we're going to look at how to access the lateral hip with ease. It's often an area that can maybe sometimes feel a little bit awkward to handle or access. So today we've put our client Joe into a sideline position, which is my favorite position to access this area. And again, we're just for the purpose of this video going to work with a little bit of compression on this. And what I do want to mention beforehand, that obviously there are other techniques that we can implement in this position for the hip, but also the anatomy of the hip as well is something that I want to address. So we have to think that as soon as the client is in side lying, the way that your fibers of your gluteals and the lateral hip are going to fan out and fall away with gravity, we want to make sure that we are sort of working with that as well and not pushing into bone or making our client feel uncomfortable. And the best way I have always remembered this from my own learning, my own teaching when I was training as a student many years ago. Teacher taught me that the hip sort of goes in this C-shaped fashion, and that's always stuck with me, and how I then maneuver my pressure and my application of, for the purpose of today, compression around the hip when I'm working with it. So if I'm working with a static bed and I don't have the luxury of a hydraulic bed to move up and down, I'm not going to be able to apply compression with my hands. And the reason for that is that I don't have the ability to sink my pressure down suitably through my body weight in my legs. Because if I come over to the other side of the bed, just to show you, from here, I can't do this without overusing my shoulders or standing on my tippy toes here. So instead, I need to think of a different applicator to apply compression. And that's actually going to be my forearm on this occasion. So as you can see, I'm just resting my hands on my client, figuring out where I want to go. And from here, I'm going to use my left forearm, keeping the wrist relaxed, to apply at and around sort of the glute med and upper fibers of the glute max in this area. And the fibers are falling away from the hip joint here in this position. So again, relaxed wrist, split stance in my legs here. And I'm just going to sink down with the fleshy portion of my forearm and help facilitate gravity in what it's doing here. Being mindful that you go slow with your depth and watching that your client isn't uncomfortable, because we have to remember as well that there are a lot of nerves that pass through this area, and essentially we are exposing some of that a little bit more in this position. Also, the glutes in general can be a sensitive area. A lateral hip can be a sensitive area for people to have worked on as well. So I'm just really taking my time as I sink down with this deeper and slightly more specific technique. Soon as I want to move further around that hip, I have to move with it. So here again, as I sink down, helping facilitate that tissue falling away from the joint, I'm using my own body weight to sink down through my legs here as well. Now, the next bit of this is where it changes a little bit in terms of my own positioning. Because I want to access the lower fibers of the lateral hip, I'm going to change the direction of my body here, because I can't necessarily gain access properly without my hands getting in the way of other places. So I need to change my direction, going back to that idea of working with this C shape. So I'm going to use my other arm and start from working from down below, sort of where the sit bone area, if you want to, lack of a better description here. And again, working around and going up through the bottom half of that crescent, up to that midline again. Good. And that's just some basic compressive techniques with the forearm to the lateral hip. A really, really big thank you to Massage Warehouse for giving us the platform to create and be a part of these series. As well, in order for us to keep continuing to create these, please like, share, and subscribe wherever possible. Thank you for joining us.